Hi, welcome back to Talk of the Town. I'm sitting here with Amber Fritz, who is the Product Implementation Manager, hope I said that right, for Dean Health Plan, and she's going to help us kind of navigate some of the more difficult things about the healthcare system in our society. So, Amber, welcome to the program.
Thank you.
So, how long has Dean Health Plan been in operation?
Dean Health Plan has been selling health insurance for over 30 years. In addition to selling health insurance plans to employer groups, something you might get through your employer for your annual enrollment period, we also sell insurance directly to individuals. They can buy right through us if you don't have insurance coverage through your employer.
Very cool. And tell us a little bit about what you do as the Product Implementation Manager.
Yep, so I'm a member of the product team at Dean, and that whole team, we split up a variety of duties. Everything starts with our product managers. They design the health insurance plans each year. New regulations come out, market trends change. We do some surveys and research to find out what the population in our service area is really looking for in their insurance. Product managers design those plans. They hand them off to me, and I help communicate them internally with all of our other business areas, making sure claims, enrollment, billing, all those departments know the key features, the requirements, the changes from the prior year, and then I help get those plans implemented in all of our systems so that ultimately we can pay our members' claims and keep track of all the details.
Right on. So you're kind of like a well-educated messenger where you have to really know all the details of each product and then be able to communicate all those details to other folks within the business.
Yep, messenger. I facilitate a lot of conversations.
Yes.
Making sure it's not two ships sailing past each
Right.
other in the night.
Exactly.
Yep.
What's one really important thing that you feel people need to know about Dean Health Plan?
What we really want people to understand is that Dean Health Plan is on the federal marketplace on healthcare.gov, and through that you can get very affordable health insurance with Dean. Affordable coverage is available. That's why the marketplace is out there, and we are participating in that. We want to be available to as many people as possible.
Right on. How do you feel your business can help viewers at home? What are some other ways that you guys can help viewers at home?
So ultimately our goal is to just educate people on healthcare reform, the ACA. We have a variety of resources available. Our website is deancare.com/sign-me-up. If you go to that with the sign me up at the end, we have tutorials, explanations of various key pieces of healthcare reform. We link you directly to healthcare.gov from there, so if you need to shop for plans and want to check out what discounts and subsidies you're eligible for, you can also buy the insurance right through that Sign Me Up page directly through Dean if you knew what you wanted to get. In addition, we have a kiosk at the West Town Mall. It's called the Dean Spot, and our goal with that is not even to sell insurance. It is to answer questions. We have qualified, very experienced customer service staff there 7 days a week to simply answer questions. We've got pamphlets and brochures. We have a really nice touch screen tutorial, and we want to help people navigate what is a very confusing and often overwhelming experience.
Yes. So this is for folks who maybe didn't ever have health insurance prior to it being required by federal law. This is a way for them to get the information they need so that they can figure out what exactly they need.
Yep, a lot of times, you hear a little segment on the news or you hear people talking about it and you don't know what it actually means for you. What do I actually have to buy? What am I buying? What am I getting for this? Is it a deal? And terms like the metal tiers and the individual mandate, things like that can sound very confusing and intimidating, and ultimately we just want to help people understand.
Absolutely. Now, it's the month of November, and as of the 15th of this month, open enrollment for the marketplace, healthcare.gov, opened again. Can you tell us a little bit about, for those of us who maybe don't know, what is open enrollment and who should be enrolling in open enrollment?
So open enrollment, you're correct, it began on November 15th, and it runs through February 15th of this year. And that's the once a year time period where everybody can go out, and if you didn't already buy insurance, you can go make a selection. And you're right, there are going to be penalties. There's mandates saying that you have to buy insurance. So this is the time where you can go do it and not face paying a penalty. If you already bought insurance and you are renewing your coverage for another year, you can go back out during open enrollment and update your personal information, and this will give you the most current and accurate discounts and subsidies. So open enrollment is kind of a very key period of time. It's a familiar thing in Medicare world. People who have Medicare plans, they have an open enrollment period. It's the same idea. It's the chunk of time in which you're allowed to shop.
Amber, Fritz, thank you so much for coming on the program. Dean Health Plan, check them out, and we'll be right back with more Talk of the Town.